So the basis of our breathing program is not traditional combat tactical breathing in the moment. So what we're trying to do is get students to practice their breathing when they're at rest. The idea behind that is that, one, we can't change the severity of the situation. So if someone has a gun pointed at you, it doesn't really matter how you breathe, there's still a gun pointed at you. But we may be able to lessen the impact that it has on your body. So we're going to start practicing at rest. So the first thing I'm going to have Ben do is just breathe normally. So I'm going to give him no cues, no prompts. I just want him to breathe. The goal is that we get away from mouth breathing, which is traditionally what we do. Over time, we've kind of developed our breathing into more of a mouth breathing system. We would ideally breathe more through our nasal cavity. We're also going to start to get him to breathe through his diaphragm. So a lot of times this is referred to as belly breathing. This is the tactical combat diaphragmatic breathing that we have. It should be our normal breathing, but for purposes of today, we're going to call it diaphragmatic breathing. And what we mean by that is usually people are fairly shallow breathers, so they use about the top third of their lungs. So if we watch Ben actually practices, so he's going to have to work at this a little bit, but to have him breathe through his chest, you can see the shoulders will elevate a little bit, the chest rises, seems to expand, and Ben, do you feel like you're taking in a big breath?
Yes.
Okay, so the reality is he is taking in a big breath, but he's not efficiently utilizing the oxygen that he's taking in. Okay. We want to use as much of the lungs as we possibly can. So oftentimes this is referred to as belly breathing. We can't actually breathe into our belly. The lungs are the breathing apparatus, but we can better utilize the lungs by utilizing our diaphragm. Okay? So now what I want Ben to do is really focus on breathing all the way through your diaphragm, down through the bottom of your rib cage into your abdominal cavity. At this same time, I want Ben to continue to breathe through his nose. So big, deep breaths in through his nose and exhale through his nose. So a couple of things happen at this time. If we continue to breathe through our nose, the first thing that happens is we can build up a nitric oxide store within the nasal cavity. Upon inhalation, okay, or inspiration, Ben will push that into his airways. Okay? And what nitric oxide does for us, it's a vasodilator. So opens up airways, opens up blood vessels. So basically, he's got a part of a pre-workout. That's what's working for him right now. We just need to add some black coffee with a little bit of sugar in it. We got natural pre-workout. Okay? So now, Ben, while you do this, I want you to start to breathe to this specific cadence. 2 seconds in, 1 second breath hold, 2 second exhale, 2 second breath hold. And continue breathing in through your nose, trying to work the diaphragm. Okay? The diaphragm is our breathing muscle. Just like any other muscle, if we want to train it, we have to work. Okay? If we want to improve our squat, we have to add some external load. Well, we don't really have external load on the diaphragm, but what we can do is force it to flatten and dome. So as the rib cage expands, it flattens. As it contracts back in, the rib cage domes. Go ahead and resume your normal breathing. So at that cadence, did you feel like you were still getting enough oxygen?
Yes.
So if we can breathe less at rest, we're going to better control our breathing in a stressful situation, whether that be exercise or that be another moment where something has alerted us and sympathetic nervous system is kicking in and we need to be able to control our breathing a little bit more. So now, just so that Ben knows he's breathing all the way through his diaphragm, he's going to put one hand on his stomach, one hand on his chest. Okay? We're going to now change that cadence a little bit. So a 2 second breath in, 1 second hold, 2 seconds out, and a 3 second breath hold after the exhale. Okay? And what he's looking for, his hands are going to give him immediate feedback, whether it's his abdomen or it's his chest that's rising. Okay? And he can do this on his own. He doesn't need a coach to stand here and tell him. He can monitor on his own. So if he feels a lot of chest breathing, he can really focus on breathing down through the diaphragm. Okay? Relax your arms for a second. Okay? Continue that 2-1-2-3 breathing cadence, and we're just going to change our arm position. So to this point, we've talked about breathing down through the diaphragm, expanding the belly. We don't actually need to expand the belly. What we need to do is expand the rib cage at the bottom of the rib cage. That allows the diaphragm to flatten out. Okay? But now he's got the feeling of what it's like to breathe down through his diaphragm. So we're going to have him go to a Superman pose. And when we do that, Superman didn't have his hands on his hips. He had his hands on the bottom of his rib cage. So now we want him, when he breathes through his diaphragm, so Ben, as you breathe through, try to make your rib cage expand and move out. Okay, same breathing cadence. So now while he does this, I'll explain a little bit about why we have a longer breath hold at the end. So on the inhale, we have a quick breath hold, and eventually we'll get rid of that. But on the exhale, we have a little bit longer breath hold, and the reason we do that is so that we can start to build up a little bit of a tolerance to carbon dioxide. Okay? We're often told, get all the carbon dioxide out as quickly as we can. It's not necessarily what we need to do. It's carbon monoxide that's a poison. Too much carbon dioxide creates a problem with diffusion between oxygen and carbon dioxide within blood vessels. So we want to build up a little bit of tolerance to the carbon dioxide. Okay, go ahead and relax your arms. Okay, so now just continue breathing. You can stop the cadence if you want to now. And I'm going to ask you, as soon as we stop that cadence, did you continue to breathe slower, or did you go back to the quicker breathing?
I'm still breathing a little slower.
A little bit slower than before, okay? So just by practicing that, he's not even thinking about it now. He's started to breathe a little bit slower, okay? So the next thing that we're going to do is do the same thing, but we're going to go to a seated position, okay? Which is where we find ourselves most of the time. We sit in a chair, fantastic place to practice. We are completely at rest now. So we're going to skip straight ahead to the 2-1-2-3 with hands on chest and stomach. Okay, now, one thing he's going to have to do, when we sit, we commonly start to raise our shoulders up. Okay? Our traps start to activate, and we take over. So he's really got to relax. And at this point, it's actually a good idea to have some sort of scapular load, so it forces his shoulders back and down a little bit. Okay? What that'll do for us, it helps our rib cage to settle down and come back in. So he's just continuing that 2-1-2-3 breathing cadence, monitoring with his hands which hand is expanding when he inhales. Okay, relax your arms. Okay, we're going to use this same breathing cadence again, okay, except we're going back to the Superman pose. Okay, same 2-1-2-3. Okay, again, he's got to be relaxed. And Ben trains regularly, so the scapular load thing kind of comes natural to him. You may have to work at it to get your traps to relax a little bit. Load your scaps, hands on the rib cage. So, and as we watch, we can see his hands actually expanding. And that's immediate feedback for both him and for the person that's trying to work with him a little bit. Okay, go ahead and relax your arms again. All right. So at this point, we've used a fairly basic cadence. This is our practice cadence. When we're at rest, we need to practice this. Okay? So now, so Ben was breathing much quicker before. Has it slowed even more now?
Yes.
Okay, so now, to illustrate that we are better utilizing the oxygen, I want you to go to a 1-1-1-1 count. So he's going to inhale 1, hold 1, exhale 1, hold 1. So this would be a traditional quick breathing box breathing method. Okay, so you can go back to your normal breathing. So did you get a little bit lightheaded at all? So
Immediately.
So he got lightheaded not because he wasn't breathing enough. He was actually taking more breaths per minute on the 1-1-1-1. The problem is he wasn't efficiently utilizing the oxygen that he was taking in. Guys, so now we're going to go to one more cadence, and this is more of an advanced cadence, but this is after we practice for a while. Okay, so nice and relaxed right now. Okay, I want you to inhale to a 4 count. There is no breath hold on the inhale. Exhale to a 7 count. When you get to that 7 count, blow out a candle. Inhale for 4, exhale for 7. Once you finish that 7 count, blow out a candle, and then hold for 3. So if we stop and we do the math, Ben's now breathing roughly 4 to 5 times per minute, okay, at rest. Obviously, during exertion or in a stressful situation, we're not going to breathe 4 to 5 times per minute. Okay, but we can do is take that normal 20 breaths per minute down to 15. In this short session, he is now taking fewer breaths per minute, being more efficient with the oxygen that he's taking in. The last piece that we're going to illustrate is in a supine position. We will have Ben show that we actually can relax our rib cage a little bit more. To illustrate this, we're going to just use his fingers. So now he's going to take his hands, put them right at the bottom of his rib cage, slide them up until the fingers are just touching. Okay? So apparently right now Ben is in a fully relaxed position with his rib cage. Okay? So what he's going to do is go back to our 4-0-7-3 breathing count. So inhale for 4, no breath hold on the end of the inhale, exhale for 7, blow out the candle, hold for 3. And what cage is actually relaxing a lot more. So on this second repetition, once I get down here, I'm going to actually go down and show you how much his fingers are overlapping. So we started out with the fingers right together. He's now on his exhale. Once he blows the candles out, we now have about 1.5 inches overlap of his fingers. That's how much more his rib cage has relaxed, allowing the diaphragm to fully dome and fully flatten out.